Well, May is Mental Health Month, and now more than ever, people being faced with challenges like they have never had to deal with before. The stress is on everyone, from adults to teens. Even young children can create the perfect storm to impact our mental health.
So let me ask you this. When is the last time you really asked yourself or someone you love how they're feeling? When's the last time you did a mental health check? Well, tonight we want to equip you with the knowledge and tools needed to start those conversations in your own home so you can feel empowered to take care of yourself and loved ones as we move forward.
Danielle DYKHUIS is a mom of 2 teenagers and an 8th grader.
Remote schooling has been very difficult for especially my autistic senior.
Like many families right now, they're trying to adjust as best they can.
My daughter would normally spend almost every weekend at her best friend's house for a sleepover, and this is really hard for her.
And just to add more to her plate, Danielle was brave enough to speak out about her mental health journey in the hopes of reaching someone who might really need to hear it.
I didn't know anything about mental health at the time. I didn't know anything about that other people struggled like me, or that these were things that a lot of people struggled with.
Back in 2007, Danielle was diagnosed with major depressive disorder, anxiety, and PTSD. She's faced a lot over the past 13 years, including several inpatient stays.
I really felt really suicidal, and we talked to Pine Rest and decided that it was best for me to go inpatient at the time and get support. It was difficult at first. I still struggled with the shame, and I still struggle with shame.
But through opening up and finding help, she's been able to build a stable foundation that has even carried her and her family through these times.
So it's been difficult, but I think because of what we've been through in the past, they've been able to be supportive and be able to be stronger than if they hadn't been through what they've already been through.
In these tough times and during this pandemic, we've got to really face the fact that everybody is facing mental health challenges right now. And so a mental health challenge is the challenge on how I'm thinking, how I'm acting, and how I'm feeling.
And right now, many people are being challenged.
So one of the biggest risk factors for a mental health disorder can be ongoing stress and stressful life situations. And so this is reality right now.
Economic distress, lack of human interaction, our daily lives turned upside down.
People could be having thoughts of, this thing is never going to go away. My life is never going to get back to the way it was. My situation with the economy and my monies are never going to go away. I might as well take my life. I mean, there are those thoughts and feelings that may be ruminating in people's heads. And that's not uncommon to feel that way at all right now. And that's why we can't be afraid to ask more questions.
And start the conversations in your own home about mental health.
Not feeling guilty for feeling this way, because a lot of times that shame, guilt, those feelings can keep us from talking about it. And that's what stigma is, feeling I'm alone and feeling like I can't tell anybody. So open conversations with our kids, with our family members. And the conversation might start with, you're not alone. I'm feeling it too.
But how do you know when it becomes something more, especially right now?
So I can notice the typical behaviors when they're doing well, but suddenly now I'm noticing the difference. And this is where it's going on for 2 weeks or longer, a marked change in their behavior.
It's about equipping yourself with the knowledge that creates the confidence to take action.
Sometimes it might be, simply put, putting something back into my life that I haven't had in my life for a while. So maybe it's gardening. Maybe it's just getting outside for a walk. And those are things that I've been not able to even get up and do. So do I have some coping skills in my back pocket?
There's nothing wrong with you for having a mental illness or being anxious or being depressed or having gone through trauma. All you need is some support.
There's hope and there's resiliency in all of us. There is, and I truly believe that. But it is going to take us to find it within ourselves, or me to be that person that is going to be the person to find that in someone else.
It gave me so much more strength in myself, and I just want to be able to give that to others.
Well, Christy Buck joining us now from the Mental Health Foundation of West Michigan. Thanks so much for your time this evening.
Thanks for having me.
Okay, so real quick, I want to get into the pledge that you guys have from the Be Nice campaign and how people right after this can start those conversations in their home.
I would love for folks to go on and take the pledge, and it literally takes 12 minutes. And it's a 4-step action plan to save a life. And the plan is to notice, invite, challenge, and empower. And so the first step is one of the most important steps, because we do often notice changes in someone's behavior, something that's not typical of how they usually are. And with that, if I do notice these changes, if I see the sadness, if I see more isolation, if I see someone's typical behavior not being the way that they normally are, then I want to invite myself to have a conversation, the I. Invite myself to tell them what I am noticing in them. Following that, I want to challenge them. It might be to get treatment. It might be to make a phone call to someone to get some type of help and assistance. It may be challenging them to find something positive in their lives to do. And that was what I was talking about in the interview. Find some coping skills, challenge that person. And then most of all, the last step is empowerment. And empowerment comes through possibly me helping and supporting them through this journey that they're on right now. Or it could be they themselves empowering themselves to do something, to get treatment, to get help, to instill protective factors. Protective factors are those things that I can go to that will help me through when I'm being challenged by a mental health disorder.
And let's talk resources, the many out there right now that don't go out, reach out services that are available. And also with that question, I want to ask, so often when we do these stories, people say, you know, mental health isn't covered. That's not something that's covered by my insurance. It's too expensive. So if you can address both of those things real quickly.
So one thing, it can be covered, and sometimes you don't even know. So if you do have private insurance, you need to make a phone call and ask them. 2, many employers have programs, they're called employee assistance programs. And it is a benefit offered through many employers where you get 6 free visits with a clinician. So find out if your employer offers this, and also ask them what resources they may have. If you do not have insurance or it's Medicaid, you need to go through Network 180. And all of these services are all through the Don't Go Out, Reach Out. So if you have any questions right now, you can also make a phone call. Pine Rest, Forest View Hospital, and Network 180, start a conversation with someone. So many times it's just like any typical thing where I might be afraid or embarrassed or ashamed, and I won't go make the call. Make the call, make the initial reach out. And if you are concerned about a loved one, you pick up the phone and make the call. Also, there are crisis situations where somebody might be thinking or talking about suicide. At that point, a call needs to be made. And there's a National Prevention Helpline, 1-800-273-8255, or texting help to 741-741. Please do not let someone go untreated if you don't know the answers, if it's covered by insurance or if they can or can't afford it. Help is there.
Thank you so much, Christy. Such an important topic. Appreciate all of that. We'll get all of those numbers and resources posted on our website, fox17online.com. And again, we encourage you to take that pledge, start that conversation in